Good morning, good afternoon, and good evening. My name is Luke Tidaldi. I'm subbing in for Greg Morrow, who had some brief technological issues right before the webcast. So I'm here. We're off to the races. We are going to rock and roll. We've got a very special webcast for you today with Carrot, entitled The Business Case for Family Forming Benefits, How the Right Partner Can Reduce Healthcare Costs While Promoting Inclusivity. So just a few brief housekeeping notes before we get started. We really would appreciate your questions during this webcast. You can do so by writing in the question box on the bottom left-hand side of your screen. We'll be able to get to those at the end of the webcast. This webcast also qualifies for CPE credits, so make sure that if you are requesting those, you click on the boxes that show up on your screen 3 times during the webcast. Some of the critical questions and issues we will be answering today are the business case for fertility and family-forming benefits, how fertility benefits can promote diversity and inclusion in your company, how to assess fertility and family-forming vendors, and then we're going to get into a little bit about Carrot. So without further ado, I would like to introduce Lee Bettencourt. Lee Bettencourt is a solutions consultant at Carrot Fertility, formerly in customer success. Lee uses her experience supporting customers and deep understanding of fertility care to provide in-depth expertise to HR benefits teams as they consider their fertility benefits options. Joining Lee is Julie Insinger, is a co-founder and the VP of Business Development of Carrot Fertility. Julie's career covers healthcare, human resources, and business operations, working with companies like Zenefits and Equilar. Her role as an HR and benefits advisor, Julie was struck by the fact that fertility benefits weren't covered well, if at all, by most employers, even though employees asked for them. So with that, I'm going to fade into the background, and I will pass the baton over to Julie.
Fantastic. Thank you, Dave. You're a great substitute for Greg, given the technical difficulties. Hello, everyone. I'm Julie. We're really looking forward to chatting with you today. We're actually going to kick off with a quick poll to get everyone engaged and to really learn a little bit about where you are so we can make today's session as relevant as possible. So, yep, perfect. People are already starting to put in their answers. That's wonderful. Today's question is the current state of the fertility coverage at your organization. So we have the choices: currently using a fertility-specific vendor. We have, for the second choice, infertility and fertility coverage through our carrier. We have, for the third question, infertility coverage only through our carrier, so requiring a medical diagnosis is that infertility part. Next, we have adoption assistance program only, and then our final choice is no coverage.
Julie, this is interesting results we're starting to see trickle in, and I think, you know, a lot of organizations come to Carrot because they have sort of piecemeal fertility and family forming coverage. So a lot of times adoption is done in-house, and there's limited fertility coverage through the plan. I'm excited to see what the majority is here.
Yeah, me too. It seems, I don't know how we see if everyone's participated, but I think we have, oh good, it's changing a little bit still. We have some leaders. All right. We're going to hope everyone was able to insert their answers right now, closing the poll for voting. And amongst your peers, what we see most often, it looks like a tie between adoption assistance program only and infertility only coverage through our carrier. So we'll really talk about that today, the difference between infertility and fertility, and we'll kind of cover that gap and what that means. And then it looks like that is followed by infertility and fertility coverage through our insurance carrier. That's great, so not requiring a medical diagnosis of infertility. And then we have a number of folks, about 12.5% with no coverage relating to fertility or family forming. That's great to hear. This will be a very informative webinar for you today. And then we have a small population, so about 4% currently using a fertility-specific vendor, which is wonderful. That's something like a carrot, so we'll talk about that today as well. All right, so we'll go ahead and jump on in. Fantastic. Thank you for switching the slide. So to kick us off today, wanted to really talk a little bit about the history of fertility benefits, where it came from, and how it's evolved to where we are today. So if we look back just 10 years, which is pretty recently, fertility care was only available to heterosexual couples with an infertility diagnosis. And that's if there's any coverage available through an insurance carrier. It tended to be minimal. So as of 2012, so just 8 years ago, it was less than 20% of self-insured companies who were offering IVF benefits, which is pretty remarkable when you think about the growth where we've come to today, where over 70% of US-based companies are offering IVF benefits. And a couple reasons for the trends and the changes we'll talk about today, but number one, a big shift happened in 2011 when egg freezing no longer became deemed experimental. And then quickly after that, so around 2014, we see Facebook as the first company who offers egg freezing as a benefit. This is really opening the door and expanding what fertility care means, going from a world where it was strictly infertility and requiring that medical diagnosis to now being more proactive and inclusive fertility and allowing elective procedures such as egg freezing. Another big shift we saw along the timeline was the U.S. legalizing same-sex marriage. That really opens the door for fertility care and different concepts of what family forming means today, and therefore what fertility benefits need to address in order to inclusively support all employees and all family forming. So then Carrot Fertility, we were founded in 2016. We were founded with a goal to meet fertility and family forming needs and demands of all people and family types. We'll cover what that is today as well. And then we're really seeing the demand for fertility benefits only increase. In the next couple of slides, we'll talk about some big demographic changes, including the U.S. fertility rate hitting an all-time low. And then that sort of leads us to where we are today, which is supporting multinational companies with a global workforce with a simple and easy way to make fertility benefits inclusive and available to all. All right. I'm having screen troubles changing the slides, so bear with me for a second. It's just a me issue. Okay. Fantastic. So talking through some of the demographic changes and really kicking off our conversation today with why fertility benefits even matter and how many people actually struggle with fertility-related complications. So there are kind of two big demographic shifts that happened that are leading to an increased demand for access to fertility care. So first and foremost, females are having children later. 50.2%, so over half of the U.S. workforce is female, and the median age for the first birth is now over 30. This happened, I think, about 2 years ago, and it's the first time in history that the age of a first birth is now over 30 instead of below 30. And one of the trickle-down effects of this is that the infertility rate is steadily rising. So today we see 15% of the population who will be diagnosed as infertile, meaning they'll need to pursue assisted reproductive technology or adoption to have a child. And this 15% often surprises people. I think historically infertility has been something that people don't really talk about that much. We're getting to a world where people do feel more comfortable talking about it, but I know this 15% is a little bit of a shocking number to some folks. And then the second big demographic change is the way that families are forming is shifting. So we talked a moment about LGBTQ, marriage access. So we're seeing trends where same-sex couples and actually single intending parents also wish to grow their family, and they need assisted reproductive technology to help. So Today we're seeing 63% of same-sex couples starting families, which is fantastic. However, the traditional options such as insurance, which requires a medical diagnosis of infertility, typically does not carry that. All right. We'll go ahead and change the slide again. Almost there. Okay, great. And so where we are today is today's workforce expects employers to get involved. It's just a little bit of their mentality, but employees are definitely asking for this. So a couple interesting stats. 60% of women would opt for a job that offers fertility benefits over other options. So fertility benefits really do help with recruiting new talent. 62% of U.S. employers would stay at a job longer if IVF is covered, which is pretty meaningful from a retention standpoint. And then 68% of U.S. employees say that they'd change jobs for fertility benefits. This is a pretty large statistic, but if you are in that 15% who needs fertility coverage, having a benefit is really, really helpful from both a financial and an emotional standpoint. And then the great thing is that employees feel better about their companies after utilizing a fertility benefit. So Fertility IQ is one of the leaders in fertility data, and they have reported that when IVF coverage is granted through an insurance program, employees report feeling more grateful, more loyal, and also stay longer. So big kudos to you in the room who are already offering a fertility benefit that covers IVF. And last but not least, we're seeing this within Carrot, within our members as well. So wanted to throw a couple quotes in here for you just so you can see that offering this type of benefit really does have a meaningful impact on people's lives. So we've had members who have proactively come to us and said, Carrot was a key reason why I chose this company over a competing offer. So again, from that recruiting standpoint, we have employees say, I couldn't be happier with this benefit, and it's a life-changing opportunity, which we hear all the time. You know, fertility benefits really can change lives. And then from an inclusive standpoint, we've had members who come in and say things like, I just want to reach out and thank you so much for how inclusive your services are. As a trans man, I was so surprised and happy to see that my needs are taken into consideration and can be covered. So it really does make a meaningful impact to have an inclusive benefit, not just a fertility benefit, but one that really covers all employees and family types from that DE&I and recruiting and retention standpoint. All right, so we get another poll, more attendee engagement. So our question this time is, why are you most interested in fertility benefits for your organization? I know this isn't going to address everybody's particular interest, but if you could select the category that fits your goals the most. Choice number 1 is optimize health outcomes and save money on healthcare. Always important. Number 2 is diversity, equity, and inclusion. Number 3 is telehealth support for family forming, which is, I think, particularly important in this work from home time. And then last but not least, employees are asking us actively for fertility benefits. So go ahead and take a moment, enter your selection. Lee, I know you work with customers really closely at Carrot. While people are chiming in their responses, would love to hear a little bit about what you're seeing.
Yeah, definitely. You know, optimizing for outcomes is ultimately cost saving, so that is a really common reason why people come to Carrot. We'll talk more about it in a little bit. DEI, it's table stakes now. Julie, I know you're going to speak to inclusivity in just a bit, but opening up access to the LGBTQ community, as well as making sure the BIPOC community has equal access to be able to find a provider. Let's see, telehealth support, it looks like 4.3% of people are interested in fertility benefits for telehealth support Obviously, during COVID, this has been really, really important. At Carrot, we saw a 30% increase in our fertility-focused mental health offering. So people were really feeling the stress of COVID and wanting support from home. And then lastly, employees asking for them. Julie, you just covered this, but obviously the demand for fertility is rising as we wait longer to have children and women are in the workplace. So both egg freezing and IVF are more common now.
Perfect. Thanks, Lee. And it looks, yeah, go for it. Yeah. Results are officially in.
Well, it looks like the results say is DNI or DEI is the most common reason among your peers here. 69% of people are looking at fertility vendors to perhaps increase their inclusivity. Beyond that, 13% for optimizing healthy outcomes. I know your CFOs would be very happy if you had selected that option to reduce healthcare spend. 13% say that employees are asking for them. That's no shock. It's table stakes now to be offering a fertility benefit. And then lastly, with telehealth support at 4%.
All right.
Okay. So we'll dive in then next to the business case for family forming benefits. And before I sort of touch on the financial element of it, I really do want to sort of talk about how COVID has impacted the fertility space and emphasize the stress that it's putting on your employees. In the first few months of the pandemic, clinics were shutting down, agencies weren't accepting new applications. There's so much uncertainty that was happening, and the world was really faced with this enormous and for people going through it, infertility, often unspoken stress and challenges. And so, fortunately now clinics are opening back up, but people are really left navigating the space kind of alone if they don't have support either through their employer or perhaps, especially a partner or spouse. So making sure that you're offering a managed care fertility vendor is something to be able to help your employees right now. That's, in my opinion, a business case in itself. And then, sort of my last little anecdote, and then I'll dive in, and why we're seeing a lot of people sort of add fertility benefits is because the demand is not going anywhere. I used to work in the fertility clinics and in the fertility space, and I've had conversations with my colleagues, and what we're seeing both at Carrot and in clinics is that the demand for fertility care is higher now more than ever. July and August have been the busiest months on record in terms of claims and in terms of members requesting appointments. So, just because the pandemic has slowed down our ability to leave home, it certainly hasn't slowed down our desires to have children. So, I think the intersection that we're in right now with the demand for cost reduction from companies, especially with so much uncertainty ahead, as well as the demand from employees, makes for pretty strong business cases to thinking about fertility benefits. So that'll sort of lead me into why having a managed care program will save you money down the road. But before we kind of look more at the granular data of how that works, let's talk about high level how fertility benefits boost productivity and both reduce costs. So we just spent some time talking about how it can be stressful in a pandemic. I think, it's no shock to anyone on this call that everyone has heightened stress and anxiety during this time. But even before the pandemic, fertility care was stressful. 40% of patients said that they were stressed about the cost of treatment. In the U.S., IVF can cost $25,000. I think the national average is $21,000 per IVF cycle. And most people need more than one IVF cycle. In fact, people need on average 2.5. So you can see where the stress from financial strain really adds up quickly, and it results in an estimated $450 billion in productivity loss just from the financial stress. So, any stress that your employees are feeling, it impacts work, it impacts the health of your organization. So you want to make sure that you're trying to address that as early on as possible. So shifting gears a little bit to the healthcare costs, moving away from productivity, I am sure that it's no surprise to anyone on this call that NICU babies and preemies are often the most expensive claims cost to an employer. In fact, I was speaking to a self-funded 10,000 person organization last week, 2 weeks ago at this point, and they had 3 NICU claims, all of which were greater than $1.3 million. So in 1 year, they spent $4 million just on 3 claims, which is significant, I mean, to say the least. So, that's one company. I know across the U.S., employers are spending $5.7 billion on NICU babies, which is 12x higher than babies are born without complications. So, sort of tying this back to the business case, offering a managed fertility program, and what I mean by that is one that's focused on sort of cost savings through outcomes, and really through the entire program. So whether that be educating employees on best practices, mandating single embryo transfers, covering genetic testing, it's really going to save you as an organization, both on productivity loss, but also on high-risk medical claims down the road. So that was sort of a little mouthful to tee us off, but looking a little bit more granularly and kind of how Carrot approaches cost savings. We look at it probably different than others in the space, and that is because we fundamentally believe that a fertility vendor needs to save you from the day that you sign up with them. All fertility vendors are going to save you on downstream medical costs, assuming they're offering a managed care program, which at this point they should be. But you want to make sure that your vendors are saving your employees today. And especially if you're going to your CFO in the middle of a pandemic and asking for a new benefit, you want to make sure that it's definitely one that they're going to approve and see results in cost savings. So we've broken it down sort of into 3 categories to which we think about cost savings: upstream, midstream, and downstream cost savings. And so I'll start with the upstream here, or savings that happen before somebody gets to IVF. Obviously, it goes without being said, but IVF is a really critical point to somebody who's struggling with infertility. But it doesn't have to be a critical point for everyone. In fact, it's not needed for everyone. And so there are less invasive options for people that they can explore before they get to IVF. That's important because IVF is invasive. They have to give themselves injections. It's 2 weeks of going to the doctor, et cetera. But also from an employer perspective, it's saving you on overutilization of treatment that may not be needed. So what Carrot does is, we support our members both through education and through giving them options to pursue family forming outside of just moving to IVF. And so with Carrot, we have a program called Carrot at Home. It gives members, again, cost-effective options, less invasive options, as well as our telehealth offering that allows employees to access experts in real time to ask questions and find ways for them that are not just IVF. Again, from an employer perspective, meaningful because the claims, the money that's saved on claims are dollars that you're spending, that you're saving. So the second area then is midstream cost savings. Again, this is really important because any negotiated rate that your fertility vendor is accessing, you should be accessing as well. You shouldn't be paying a premium for your vendor to go out and negotiate rates on your behalf. Let those claims or both those savings be passed directly onto you through the claims. So what Carrot has done, we've obviously curated the largest network of high quality or center of excellence providers. That's important from a physical location perspective. Again, employees going in and out of the doctor for 2 weeks at a time, having to have appointments every day. But importantly, from the employer perspective, we've used our bargaining power to negotiate steeper rates on your behalf, and we pass those savings directly onto you, both on medical and on pharmacy. Pharmacy is incredibly expensive. Typically, it's somewhere between $5,000 and $7,000 or $8,000 in cost during an IVF cycle. So making sure that you are, saving on medications as well. And then the last area, finally, in the cost savings are the downstream cost savings. We've already talked about how NICU babies and preemies can be increased if you have an unmanaged IVF program. And again, what I mean by that is a program that's not regulating for single embryo transfers. If you have a program that allows for people to go and push for multiple embryo transfers, 2, 3, 4 embryos, you're almost certainly going to result with a higher instance of multiple births down the road. So, the truth is, and the truth of the matter is that people are accessing fertility care right now, whether you're offering a program or not, but making sure that you're offering a managed care program and trying to control for future spend is going to be critical. Obviously, you don't want to be the organization that I spoke of just a few minutes ago that spent $4 million on 3 claims. So let's try and, control for ESET and cover genetic testing, which is going to result in higher ESET. There are a lot of things that you can be doing to make sure that you're protecting yourself in the long run. Okay. So I'm going to kick it back to Julie to talk about the D&I portion and how fertility benefits can promote DEI.
Perfect. Thanks, Lee. And yes, getting through the actual numbers is really important from cost savings. And we're also excited to talk about the business case from a diversity and inclusion perspective, especially since our poll in the beginning indicated this was a really high priority, I think the highest priority for many of you in this room. So hopping on to what we really mean by DE&I in the world of fertility specifically, and we chatted about this a little bit before, but really having a fertility benefit that includes everyone, no matter how they personally think of their fertility or what family forming might mean to them. So for some examples, and what we cover at Carrot is fertility is anything from basic fertility education, right? So giving our members access to talk with a fertility expert when they're just exploring fertility and learning about their fertility. So that fertility education. In this country, we don't get a lot of fertility education through school, and so we find at Carrot we're helping educate members a lot on their fertility basics and how to think about their fertility, even if they're not ready to start a family right now. The other thing that is fertility today is fertility preservation. So this is really upticked in the last couple of years as far as men and women looking for fertility preservation. So this can be egg freezing, this can be sperm freezing, and this can be embryo freezing. So having a benefit that offers the preservation option for employees who aren't sure they want to start a family or aren't sure they want to start a family right now. And then, of course, fertility benefits include IVF and IUI and the typical sort of what we think of as infertility treatments. But again, removing any requirement that limits that coverage to heterosexual-only couples. So being able to cover IUI or IVF for heterosexual couples, same-sex couples, and prospective single parents looking to start a family. And then importantly, surrogacy is also sometimes called gestational carrier arrangements is also really key for those who are not able to carry a baby and need that uterus to be able to carry it. And adoption, so family forming through adoption is under the fertility umbrella as well. And then last but not least is donor material, so donor egg or donor sperm for folks who need that material. So all of this is going to give you what is needed to have a very comprehensive and inclusive fertility benefit that's not just limited to IVF for heterosexual couples.
Julie, I would just add in there, and interestingly, what we're seeing in the market is the largest area of growth in the fertility space is actually surrogacy. Both from a coverage perspective, so more people are now covering surrogacy than ever before, but also from a claims perspective. It's the quickest growing submission of claims area that Carrot's seeing, and I know we've spoken to some peers in the market and similarly for them as well.
Great, thanks, Lee. And through CARET or whatever fertility route you go through, it's important to support each member's unique journey with personalization. Fertility care can be, scary. It's a lot of information, and personalization really makes a member feel included and supported through whatever their fertility journey might be, via any of the situations we talked about on the previous slide. And then I know in our poll earlier we asked about telehealth solutions. Telehealth solutions are really important for your population to access fertility care and for questions to be answered from the comfort of their own home. So they don't necessarily need to go into a fertility clinic, but employees, whether they're US-based or global employees, can really use these types of solutions to get information that works for them. All right, and kind of the next big chunk for thing to keep in mind for having a diverse and inclusive fertility benefit is being able to navigate to culturally competent care. So I found this really interesting, but a growing body of research indicates that sharing a racial or a cultural background with one's physician can lead to higher patient satisfaction, better adherence to medications, which is really important in fertility when oftentimes in an IVF cycle you're taking medications every night for 12 nights, and then ultimately better outcomes. So the data supports this. We've actually seen our members at CARET ask for this, and we're very proud to have recently built and launched just a couple months ago at CARET, allowing members to request to be matched with a BIPOC provider or a provider of a specific gender, which ultimately helps them feel more safe, more empowered, more secure, and then leads to those better outcomes of better patient satisfaction, adherence to their protocols, and then ultimately better outcomes as well. And when we launched this, we heard some really great feedback from our champions, saying, hey, this is such great news. I'm so excited to share this with my employees. This is awesome. And so we're getting really great feedback, both from our buyers as well as from our actual members feeling more comfortable with this.
Okay, so I guess I'll tie us together here on cost savings and DEI. Box has been a client of ours for several years now, and one we've helped both reduce the claims cost for, but we've also improved employee satisfaction, as evident through surveys we've done with them. But importantly to call out that when Box was evaluating vendors, Mary Beth Kramer, their head of global benefits, realized early on that they needed a vendor to not only deliver a financial benefit, which is obviously important for those who are accessing care, but also to provide programming, education, and care navigation. That was key for as they call themselves, as they're dubbed, boxers, to make sure that they were providing their employees the absolute maximum value of a fertility benefit. So I won't spend too much time really talking about a case study here. I know that MB, Mary Beth, spoke with us at Conference Board's Employee Healthcare Conference, and it's on the website if you want to check out more about the case study. Okay, so we've covered a lot about cost savings and inclusivity. It sounds like from our poll earlier that there are people in various stages of the vetting process and thinking about offering a fertility vendor. And so we want to tee you up with some questions that you should be asking as you're kind of assessing and re-looking at what the program that you're offering today includes, or if you're looking at bringing in a new vendor. So I'll have Julie walk us through the first two, and then I'll close us with the second two.
Perfect. Thanks, Lee. So feel free to write these down if you're actively thinking about vendor choice, and or email us. We're happy to share this with you as well. But number one, inclusivity. As we've talked about today, this is very important and also seems to be top of mind for many in this room. So number one is an infertility diagnosis required to access any portion of your service? Keep in mind an infertility diagnosis really limits who can get care and often places burdens on same-sex couples, but also prospective single parents, and then folks looking to do elective procedures such as freeze their eggs if they're not ready to have a family yet. So ask about the infertility diagnosis requirement or not. Number 2 is ensure or ask about if your services are inclusive of all family forming paths. So does this include adoption? The poll indicated a lot of you already have an adoption program, which is great and signals that you know how important an adoption assistance program is. Does your program include gestational carrier or surrogate arrangements? Number 3 is, does your offering cover fees for donor tissue? So this can be donor eggs, donor sperm, donor embryos, and gestational carrier expenses, so surrogacy-related expenses. From an inclusivity standpoint, this is important to many folks, right? Heterosexual couples might need donor material, but importantly, you know, a male-male couple is necessarily going to need donor eggs and someone to carry the baby. So LGBT couples and in inclusion, this is definitely an important question to ask. Number 4 is, are your clinical and agency partners LGBTQ friendly, and how do you measure that? Carrot can help with that measurement as well. All of our partners are LGBTQ plus friendly. And then last but not least, do you work with a diverse group of providers? Want to make sure everybody feels comfortable at their provider of choice and they feel like they're getting the best care. So making sure that that provider list is diverse to match your existing diverse workforce. All right. The second big category to look at is finances. So when you're evaluating your fertility provider, ask how they generate revenue. Surprisingly, this is different for everyone, pretty significant models, and you'll want to make sure that the way your provider generates revenue is in line with how you want them to and what your incentives are and your company goals are. Number 2, how much does my company get billed per treatment cycle? You know, sometimes this can be a little bit vague, but your CFO is certainly going to want this, and you don't want surprises at the end of the day on how much you expect a fertility benefit to cost your organization, and then find surprises at the end of the year. Number 3, do you provide flexible financial coverage? This is kind of interesting, and we're seeing a lot of questions about this at Carrot this year. So by flexible financial coverage, what we mean is selecting a benefit amount that works for your organization, right? So some, for example, insurance carriers will bundle a round of IVF as a single cycle and have requirements about what you need to cover. But we've found that flexible financial coverage is actually really what's wanted by companies to find a benefit amount that works with their organization. So at Carrot, we'll help you with this. We can come to any amount really that's customized for your company and what your employees need and what your organization needs as far as what that benefit amount is, but really making sure you don't break the budget, especially in a year like this year where budgets are top of mind and some companies are working on a bit of a stricter budget. Next is, can you separate pricing by treatment costs versus vendor fees? Again, very important to make sure your vendors' incentives are aligned in yours and there are no surprises in here. And then last but not least, do you have proof of bringing improved retention, better health outcomes, and ultimately cost savings for your customers? I know we're talking about the business case for fertility benefits today, so this is certainly top of mind, hopefully, for most of the attendees, but really using your benefit to drive better outcomes for your business in terms of retention, cost savings, et cetera. All right, and Lee, you can wrap us up with considerations.
Perfect. So let's move on to the third category here, which is services. And Leslie, I see your question in the chat box about a pregnancy prevention program. I will address that at the end of this already sort of lengthy list here of questions. But I think, the takeaway on the questions here is if you're implementing a fertility vendor, you obviously need to be thinking about your entire workforce. That is why the diagnosis is important to be removed when possible, to open up access to the LGBTQ+ community. But also coverage for surrogacy, for same-sex male couples. Surrogacy is a requirement. There's really no other option unless they're going to go through adoption. So I'd really start by asking a vendor, are all paths to parenthood covered? Make sure that you're not just including a single portion of the population through covering things that do require that infertility diagnosis. Next is, when we say the entire workforce, I think we actually mean it. Does your fertility vendor cover a global presence that you might have? You want to make sure that your vendor, when you say covering everyone, isn't a subset of the population in the U.S. or a subset of your population on a global scale. So covering everyone equally. We've talked about how COVID-19 has impacted fertility care today. So you want to make sure, again, when thinking about the entire workforce, that your vendor can cover remote employees. As I sit here in my apartment today, I think we're all likely to be remote. So making sure that those working from home have equal access and equal opportunity. Ask your vendor to do a geo-analysis. Make sure that your employees have quick coverage to a clinic or quick access to a clinic. I'd also think about the employee experience a bit. So how do employees pay for care? Can they use an existing HSA or FSA? We'll talk about compliance in terms of the HSA in just a bit, but that's definitely something you want to be asking. If you're already allocating funds, make sure that they can be used towards fertility care. Does the vendor have a white glove approach to offering care, to supporting your members? Are your employees having to call a 1-800 number? Or are they actually working one-on-one with somebody the entire way? Is the benefit easy to administer? How long does it take to launch? Do you have a single point of contact as the champion? How responsive are they? Obviously, you want to support your employees, but you obviously need to support yourself if you're the champion and the one administering the benefit. You want to make sure it's easy to use, easy to get quick responses, get the data that you need. When you have to show up for a meeting with your boss, you want to make sure you're prepared for that as well. And lastly, sort of understanding who is communicating with your employees. Do they have access to talking to a fertility doctor? Do they have access to talking to an adoption attorney? Without having to sort of step foot in a clinic and spend financially, can they access these sort of experts through the platform itself? And then Leslie, finally getting to your question here, I guess it's sort of a service question. Can Carrot support a pregnancy prevention program? I guess the answer there is, typically pregnancy prevention is done through the health plan. Carrot is by no means going to rip and replace OBGYN care from the health plan. It's an Affordable Care Act 10 staple requirement coverage, so we're not looking to replace that. What we do is offer employees access similar to the expert chats with fertility doctors. They have access to OBGYNs. So if they're thinking about, pregnancy prevention and what might be best for them, that is absolutely a starting point. We also, of course, cover egg freezing and sperm freezing. That's not necessarily prevention, but it is for those who are thinking about fertility down the road. So sort of two-pronged approach there. Okay, and the last area of questions we want to give you or arm you with is compliance-related questions. You, of course, as an organization, want to expose yourself to as little risk as possible when offering benefits as a whole, but especially when offering fertility benefits. So really understanding any legal implications when choosing a vendor. Are they HIPAA compliant? How do they navigate compliance issues alongside with you? When it comes to fertility, unfortunately, there's some gray area in the tax code. The most buttoned up postured approach would be to tax egg freezing, since there is not clarity that that is a tax-free medical benefit. And so making sure that your vendor can support your tax posture. Or if you're a little riskier in your tax stance, which probably no one here is, making sure that they can provide reporting monthly so that you can apply appropriate taxes. Let's see. Again, going back to global, if a vendor is saying that they're global, making sure that they can navigate employees appropriately. There are different laws and regulations in terms of fertility when it comes to outside of the U.S. So make sure that they're giving you examples of the regulatory and cultural considerations. In Japan, egg freezing is legal, but it's not necessarily culturally accepted. So there are only a handful of clinics that offer coverage. In France, egg freezing currently is legal. It's sitting in Parliament to see if it's going to be passed as an eligible service in that country. So you want to make sure that your vendors aren't just applying what is applicable in the U.S. to other countries where it's not always legal. And then lastly, in terms of sort of compliance or legal things to be thinking about, is privacy. This is, of course, important. It's important both for you as the vendor, but it's also important for your employees as well. So can the vendor sort of give insights and guidance and offer a fertility service without having to compromise anyone's privacy? Okay, we covered a lot. I hope you jotted down a couple questions that you might find helpful, or again, as Julie mentioned, reach out to us if you want this list. We're happy to share. I think Julie's going to sort of close us out with a little bit about Carrot, and then please put in some Q&A in the chat box.
Perfect. Yes, thank you, Lee. So we've certainly covered a lot today, and I wanted to quickly touch on who we are at Carrot. Carrot is a global fertility solution. We're turnkey and easy to use. We cover all of our clients' employees in over 40 countries around the world, so a global solution as well. Yeah, and employers love Carrot not only because they can put in place a very meaningful benefit for their employees that can actually affect lives and affect recruiting and retention, but importantly, as to the theme today, that can have a very strong cost-saving business case that makes the company better, right? So it makes the employees happier, your CFO happy, and ultimately is a win for the benefits team as well. We work with companies of all sizes, all funding types, all industries. Some of our clients include Netflix, Barry's Bootcamp, Cliff Bar, Stitch Fix, Twilio, Box, to name a few. We'd love to explore Carrot for your organization if you're interested, so feel free to reach out. And without further ado, we will open it up for questions.
Julie and Lee, thank you so much. To our audience right now is a great time, if you have been holding on to those wondrous questions, to write them in that box on the lower left-hand side of your screen. We got a few minutes left, but I'll get the ball rolling here. First question I've got is, you mentioned Carrot is global. What if I have employees in countries you aren't already working in?
Oh, that's a great question. I'll jump in to start, and then Lee can pepper in. So we'll take a look. If you're interested in Carrot for your organization, we'll take a look and do a geo-analysis of where your employees are. If Carrot is not live in a country, we're constantly expanding what countries that we're operational in, and we will take a comprehensive look. We look at a number of different factors. Legal and regulatory, as Lee was talking about, is a big one. We'll look at cultural care in that particular country. We'll look at financial aspects, so what is the cost of care in each of those different countries, and we can certainly expand based on your company's needs. Anything to add to that, Lee?
I think you hit the highlights.
All right.
Great. We've got a question here from Lori. Lori asks, when an employee offers a fertility benefit, what percentage of the population generally utilizes it?
It really varies based on organization size and industry and communication plan and how well a benefits team really promotes a fertility benefit. So there are a lot of factors that go into it. Generally speaking, our book of business, we see somewhere between 15 and 22% of the population actually signing up for the platform, getting education, chatting with their care navigator, having those expert chats, reading library content. So those who are really just sort of trying to learn more and educate themselves, again, ish 15 to 22% of the population. We've seen that as high as 35% in fact. And as far as using the financial element, so how many people are actually going to go out and receive treatment or services, again, it very much varies based on your demographic. Are you heavy female, or do you have a young working population? Do you promote things like preservation? But generally speaking, we see somewhere between 2 and 5% of the population going out and using the financial element of the benefit.
Great. Next question I've got here is, tell me a little more about your network and approved providers. How do you vet
do you want me to take that one? I'm happy to answer. Okay.
Sure, go for it.
So we have a Center of Excellence standard that has been adopted by or written and reviewed by our Chief Medical Officer, who's a practicing reproductive endocrinologist. We take into consideration a lot of things. Is the medical director board certified in reproductive endocrinology? Is the lab director, do they hold it's called an HCLC certification? It's the highest certification in embryology lab. What does their patient access look like? Can our members be seen within 60 days? What is their outcome data? Do they, have high success rates? Do they have low miscarriage rates? Do they have high implantation rates? So we're focusing in on outcome data there as well. Something that's different to Carrot when we think about the network is we're not financially tied to it. So we can add and remove clinics to the network as long as they meet our criteria. We can do that in real time. And so we're not sort of pushed to build the network based on best negotiated pricing, although that is another area that we look at, but it's certainly not the only area. Again, accessibility to your employees is really important, both from an LGBTQ perspective, but from a physical location perspective, making sure they're getting the highest quality of care, both from the provider and the lab perspective. I could speak about that for a long time, but I think that's probably the high-level look at our network.
All right, great. Next one I've got is, my company has employees in countries where there are legal restrictions around egg freezing.
Yeah, that's a great question. I spoke just a second ago about the France example, where it's not legal to freeze your eggs. In Ireland, actually, GC is not legal there in the country, but it is legal to work with a GC outside of the country. So Carrot frequently sees members going to Spain, which is a much more fertility-friendly country, and Carrot helps navigate employees both in finding an agency that is available to them, making sure that they're working with a legitimate agency and gestational carrier, helping navigate sort of the cost differences from going from Ireland back to Spain or Spain back. And then also the implications of bringing a baby back into the country that wasn't born there. So we're certainly very, very familiar with what we call cross-border care. We are never going to recommend that an employee do a treatment or service that is not legal in their country. And if it's not legal to do cross-border care, again, unfortunately, we're not going to recommend it. We'll always follow local rules and regulations. But when applicable, we're happy to navigate across borders.
All right, wonderful. Julie, Lee, any final comments before we
Nothing for me. Thank you, everyone, for attending.
Thank you, everyone, for your time today. And get in touch. We're happy that you're thinking about a fertility vendor, and I hope you left with a couple questions to ask as you evaluate in the process.
All right, Julie, Lee, thank you so much. To all of our attendees out there, we've got a couple of promotional events for you. You can use the code KN1 to save $100 on our event Maternity Through Elder Care. That's November 9th through 10th, 2020. Also, if you're interested more in this topic, you can join us September 9th at 2 p.m. Eastern Standard for a webcast entitled Opportunity Amidst Chaos, How COVID-19 Might Change Healthcare. With that, I will close us out. Thanks again for everyone putting up with this swift pivot while I stepped in for Greg, Julie, and Lee. Wonderful, and thank you so much again.